All right, welcome back, and it's time now for our interview segment. The National Primary Health Care Development Agency has disclosed that a total of 189,310 children in the southwest of the country lacked routine immunization from January to June 2023. The Executive Director and Chief Executive Officer of the NPHCDA, Dr. Feyisayo, stated earlier this year that Lagos has the highest count with 79,279 zero-dose children, followed by Oyo State with 53,812 children, and Ondo with 30,280 children. Osun with 19,737 children, with Ogun with 3,204 children, and finally Ekiti with 2,998 children who have never received any form of vaccination. So this morning, to discuss about the benefits of immunization in children, we have our guest and epidemiologist, Ebenezer Akintoye, on standby to give us more details. Good morning, Ebenezer.
Good morning.
It's nice to have you on the show.
It's my pleasure.
Good morning. Thanks for joining us today.
Good morning. Good morning. Thanks for having me as well.
All right. So I would like us to tell. I would like you to tell us the difference between child immunization and child vaccination, because we hear people say the words differently. Some will say I'm taking my child for immunization. Some will say I'm taking my child for vaccination and all of that. And earlier this morning, while we were talking, I made an illustration. I saw, just on my way coming, I saw two women in the bus talking about this child immunization, and both of them were not learned really, but one was saying she had stopped taking her child for immunization, that because she doesn't even see the reason why she should take the child for immunization. And the other was like, that even though she doesn't know what they are giving them, that she just takes the child for immunization, and that by the time they write the next appointment on the card, she just take the child there, though she doesn't know what they are being given, but she knows that it is important. So just tell us the difference between child immunization and child vaccination.
Okay, so these words they're actually the same thing. They are used interchangeably, like vaccination and immunization. Generally, if you want to ask me the definition of immunization, I will just tell you it's a process by which a person becomes protected against disease through vaccination. So by the time you are immunized, it's a just like let me explain in simple terms. So you understand that when somebody is immune to a disease, that means the person cannot cut up with the disease anytime soon. Okay, so that's immune. So by the time, how do you get immune? You get immune because you are by vaccinating against that disease. You understand? So immunization and vaccination are just what is used interchangeably. Okay, so there is literally no difference because immunization is just a process at which you get vaccinated. Okay, so you don't just get yourself confused in the process. Okay.
All right, so like the illustration I gave earlier, now let us know how important it is for a child to get vaccinated, and from what year to what year. Is it that we just take some very important ones and then we stop? Because I remember back then my child, in fact, I'm almost guilty of this really, because I just felt that they've given him the important ones, and anytime we go for the appointment, they just administer vitamin A, just vitamin A today, vitamin A, and all of that. And I really almost stopped. That what's the essence of vitamin A that I cannot get in the food I give him, or I cook for him, and all of that. So how important is child immunization?
Okay, so generally there are numerous importance to that is attached to child immunization, and especially in the part of in the world that we have. Okay, so normally immunization is one of the most important and one of the most cost-effective public health intervention that is made available at the moment.
Yeah.
Okay, and as at now, it is averting over 4 million deaths in the world. Like it's protecting against 4 million deaths in the world as at now. And we want to recall that there was a time in 2020 when Nigeria was declared polio-free nation. But apparently, I think in 2022 we started having new cases of polio virus. And what I'm trying to point out is that during the little period between 2020 and 2022, before we started having new cases of polio vaccine, saved Nigeria a lot of money, okay, in regards to the effect at which polio causes. Okay. And also, we should understand that these things, vaccination, or let me just say immunization generally, has a way of protecting not only the child, but also protecting the community as a whole.
Wow.
Okay. Let's assume that you have been vaccinated against tuberculosis. Okay, for example. So you have been vaccinated against tuberculosis. That means you are not going to come down with tuberculosis. And at the same time, because you are not going to come down with tuberculosis, you are never going to affect anybody around you, okay, with these things. Okay, and of course, according to WHO itself, we want to look at the financial gain that is attached to vaccination. You see that to every $1 that is spent on vaccination, you get a return on investment of $44. What does that mean? That by the time I spend $1, imagine me investing $1 in something, and I am getting a return on investment of up to $44 per in return. Okay, and how do you get this return? Because number one, you're not going to be an health burden. You are not going to be a burden to the health sector of that nation in terms of the disease in which you are being vaccinated on. You are going to be very impactful in the process because number one, the less time spent on the hospital bed, the more productive you become. Okay, and that's why I'm saying that when all these things were done during childhood. Okay, now that also includes the fact that there are also social and economic benefits to these things. So the importance of immunization cannot be overemphasized. Like it is so numerous that we cannot just say it is just this that is the importance. It's just this that is the importance.
Okay. A child might have been immunized against a certain, maybe polio or yellow fever, and on immunization plus days where this immunization officer has come around, they still give the child that same vaccine that he has been given at one point in time or the other. Will this have any effect, and is there anything like overdose when you talk about immunization?
Okay, yes. So I literally had a case recently of tuberculosis when a child was given an overdose of tuberculosis vaccine.
Wow.
Okay, and it actually led to the death of the child. And if you want to talk about there is also a case of Feyisayo sometimes ago when they came in to test run their drugs and other thing. Okay, so overdose is it. But the problem we have in the country right now is that we have very bad, we are very poor when it comes to health records. Okay, and that is why sometimes when some people come, and especially when you have a parent, when the child has a parent that is not learned, so they don't even understand the difference between this and that. So when some people come in and say, okay, we want to give your child a vaccine for polio or thereabouts, they open up the child, give. You want to give your child vaccine for this, they open up the child, give. Not getting the medical history of the child, if it has been one vaccine, if you have been vaccinated or not. Yes, so all these things are one of the issues we are currently encountering in the country at the moment, and that's because we have failed a little in terms of keeping an accurate health records. Of course, because we have failed in that aspect a little, and I'm very sure that with the current situation on ground, we are trying as much as possible to improve and to improve on these things. And that is why every child that is born now has a way in the hospital in which he is born, in any facility in which the child is being born. They have a way of doing their things. They go through every vaccine process and they give the child a card that he holds on to anywhere. So by the time they want to give any vaccine, you just show them, okay, yeah, I've been once vaccinated against this, I've been once vaccinated against this, I've been once vaccinated against this. So there are clinical effects to getting overdose of any chemical drug, any chemical. Okay, there are clinical effects to that. But as much as possible, we in the public health sector are trying as much as possible to see how to mitigate these things and reduce it drastically by keeping a very good health record and teaching out ways at which these health records can be kept and can also be effective in the process.
Yeah, thank you. All right, so she talked about vaccine for polio, vaccine for yellow fever. I know that when a child is delivered, I think the first vaccine administered is BCG, and I think we have OPV and all of that. But can you just tell us some of these vaccines? And you know, some people don't. There are some mothers that I have met, or some parents rather that I have met, that they just say, it's OPV my child wants to take today. It's this thing. And some of these nurses who wants to administer these vaccines will ask them, okay, what is the meaning of what is the meaning of OPV? What is the meaning of BCG? And then everybody starts to look like, I don't know. I shall know that my child wants to take this. So can you just kind of enlighten us to a few of these vaccines that the student you take from, like, say 1 to 2 years, and then the names, what you're supposed to cover for?
Okay, so the few that I am aware of is the first one should be hepatitis B vaccine that should be given within 24 hours of birth to every child that is being delivered. The hepatitis B one is very important. Then there is one for the DTAP, that's for tetanus. That's, I think, around 2 months old, and that's also very important. Then we have the HIV, which is the influenza type B vaccine, that should also be given. And then we also have I think the pneumococcal vaccine. Okay. Yeah, that's one for that's staphylococcus, the bacteria and staphylococcus aureus. That's also one of those things that should be given within the first 5 months in which a child is being delivered. And another very important one is the rotavirus vaccine. And this also stop the causes of diarrhea in children. You know, currently in Nigeria, we are currently facing a lot of issues when it comes to diarrhea. A lot of under 5 children dies due to diarrhea. And
talking about rotavirus, I have had some experiences now that by the time you get to the health centers, they tell you that they don't have rotavirus because it is expensive, and then you have to go to the private hospital, and private hospital have to bills you like about 12,000, 13,000 naira for this virus. And I have seen some mothers say that, oh, it is not important, this and that. It doesn't really there's nothing that will really happen to the child like that. And you know, some of them will, by the time you go to that health center and they don't have, you feel that if it seems my child can survive without this rotavirus because the health center is not making it available. Do you think this is true?
Yeah, okay. So I will be sincere with you that the fact that you are not vaccinated against a disease doesn't necessarily mean you will come down with it. Okay, if you are not exposed to the disease. And of course, we understand how very expensive rotavirus vaccine is. And that is why we are trying as much as possible to see how to strengthen the primary health centers. See, the closest health facility to a common man should be the primary health center, and vaccination takes place in the primary health center. And we understand how the primary health care system in the country right now is in a little bit of, shaking level. It's like kind of shaking a little, and that is why apparently you will discover that only 1 out of 20 people visits a primary health center. We all run to the secondary facilities, the general hospitals around, and sometimes because of common headache, somebody can say he wants to run and go to the teaching hospitals, which are the tertiary institutions. So that for one is one of the problems we are currently encountering in the country, and because the primary centers are not well equipped, and this has caused a lot of damage in terms of the vaccination process generally, not even in rotavirus vaccine alone. That has caused a lot of problem when it comes to vaccination generally in the country. And of course, we understood, and I am quite aware of the whole problem, or especially at this rotavirus vaccine of a thing, how very expensive it is. I think it's one of the most expensive vaccine that is on ground right now.
Yeah.
Okay, and it is very important because you have to take like 2 or 3 doses of it. So that's for one. You are not taking one and I say you are done. You have to take like 2 to 3 times before you are yes, you are good. Okay, and that is why a lot of people would rather shield their child. We understand the poverty line in the country right now. So a lot of people would rather shield their child away from this one is not important. Let us go and take another thing. As long as my child is not taking that, is not exposed to diarrhea, and we can never tell. A lot of children, a lot of under 5 children are exposed to diarrhea because they have toys. They play with toys and they are on the floor, running up and down, putting their hands in their mouth, whatever. So these are very likely factors that can actually make them come down with diarrhea at any time soon. So this for one, it's one of the major problems. But I will always advise that no matter what, rotavirus vaccine is very important for every child.
Okay. I noticed that when most mothers take their babies for vaccination, by the time they come back, the baby starts running temperature and all of this. They're always complaining every time they take their children for vaccination. What is the cause of this effect?
Okay, so generally there are side effects to vaccines. Okay, and by the time you take a vaccine, what we are doing generally when it comes to vaccine is that you are inserting the pathogen. For example, let's say I want to vaccinate you against COVID, for example. So what I am doing generally is trying to insert a little portion of the virus into your system. So what it does is when you insert this portion of virus into your system, it creates an alarm in your body. So your immune system again comes up immediately and say they want to fight this virus. Meanwhile, it's a false alarm. Are you with me? So it's a false alarm. So by the time it comes together, I say yes, I want to fight this system. There is a change in your body chemistry. Okay, so the change in the body chemistry is what is causing all these side effects, and it's not totally in all vaccines. There are some vaccines that you take that the child takes and there won't be any effect, and there are some that you take it actually gives this effect. So because of this false alarm, the immune system is doubled up to work. Just like let me say it in the military form. Just like example, the country was alarmed that there is a war coming, and because there is a war coming, the president decided to give an order that all military men should stand up and start doing training, and so they have to double up their training. Some people that were sleeping already, they have to come up, double up their training and say they are ready for war, go to the borders to say they want to start defending the walls of the country. So all these things has an effect, because they are doing it when he's not ready. Okay, so they have to speed up things, and that's the same thing as occurring in the human body. They are doing something they are not really. It's not that they are not prepared for it, but they are not they have a time frame at which they are preparing for it. But because we say, no, yeah, it's time for you to come up immediately. So that is why these things are occurring. And you can't, the baby cannot or sometimes can escape all these symptoms, okay? But these symptoms are quite they are quite understandable and they are quite normal. But by the time these symptoms are going beyond they are going beyond the time frame in which you expect them to go down. For example, if you are taking I know if you are taking the rotavirus vaccine, for example, if you're taking the first, second dose, and begin to, spool a little. Okay. But if the stooling now goes beyond a day, then I will advise that the parents should see the doctor immediately.
Okay. All right. Still talking about vaccine, I have seen there's a vaccine for measles, and I have seen kids being administered this vaccine, but I feel that this vaccine is supposed to make them immune to measles, not even letting them have measles at all. But I still see these kids having, some of them have symptoms of measles, and some of them, the whole body is just full of rashes and all of that. But I just feel that since they have been administered this vaccine, they're not supposed to have these measles at all. So what do you think about it?
Okay, so generally, the way vaccine works can be sometimes difficult to explain in some areas. This is it, that you are vaccinated doesn't, just like, let me take you back to the COVID period. You know that by the time you are vaccinated against COVID-19, you are still advised to follow through on every necessary precautions, like you must use your nose masks, at least take like 2 meters away from somebody, and make sure you stay away from isolation centers and everything. So the fact that you are being vaccinated against some disease doesn't necessarily mean you need to now start exposing yourself so much to these diseases. And the way the MMR vaccine works, which is the measles vaccine, it actually has its own unique way of this thing. So every child must, as much as possible, that has been vaccinated against measles, but as much as possible to take precautions guiding against this measles. They must prevent themselves, or the parents must, as much as possible, try as much as possible to prevent the child away from anything that can actually lead to measles around. And also, we should also get to put it at the back of our mind that immunization doesn't necessarily guarantee total, and I repeat, when I mean total safety,
total clearance from diseases.
So the word total is very important, because it is not, I'm not saying that immunization are not effective. I'm not saying vaccinations are not effective. I'm only saying total, okay? Because if you are just like the fact that you are saying I am being immune against this, doesn't mean you need to start toying around these diseases as well. So every parent must, as much as possible, take care of their child even after being immunized. Their health must be the health status of the child must be taken with utmost priority. Everything that includes cleanliness, everything that just affects their health must, as much as possible, be taken with utmost priority.
All right, thank you so much. I've learned a lot today, and I hope that our viewers too, they've learned one or two things. They've learned that it is important for us to immunize our children. Thank you so much, Ebenezer.
Thank you for joining us.
Thank you for having me.
It was nice having you. All right, you've heard our guest, the epidemiologist. You've heard him say immunization is very, very, very important for children, the age range of 0 to 5 years. So take your child now. If you know that you are guilty of this, take your child now to the nearest health center available, just to immunize that child, immunize them from measles, from polio, and all of that, just for us to have a healthy child. All right, that's what we have for you on the media, on the interview segment for today. We're going on a short break now, and when we come back, Daybreak Africa continues. Please stay with us.